morning once again to our viewers at home and around the world. And I would also like to welcome our guest. Good morning, Dr. Stella.
Good morning.
Pleased to meet you.
I'm glad to be here. Thank you.
Thank you very much. Now, today we'll be looking at a new topic, chronic kidney disease, a silent epidemic. Chronic kidney disease, a silent epidemic. Okay? The world celebrated World Kidney Day on the 10th of March. Usually every second Thursday in the month of March, the world celebrates World Kidney Day. It is a time that we highlight the challenges that this problem poses to mankind. It is no longer news that 1 out of every 10 adult persons globally have CKD. Surprisingly, a good number of them may not even have an idea that they have this disease. More than 37 million people in the US are said to be living with chronic kidney disease. What is chronic kidney disease? Chronic kidney disease is a condition, is a medical condition characterized by progressive loss of kidney function over months to years. Oftentimes, it could go unnoticed without any symptoms. Until such a time, there will be a significant loss of kidney functions. At about that time, it could start presenting with symptoms. What is kidney? Kidney is an organ that is found in the human body. Usually 2. Every human being has 2 kidneys. That's in ideal situation, though. And these kidneys are located below the rib cage towards the back. On either side of the spine, that's the backbone. And of course, this is one of the most complex organs in the human body. It does a lot of functions, but a good number of us will remember kidney for the fact that it helps to remove waste, chemical and toxins that are not useful from the body. It's converted in form of urine. But beyond removal of waste, a good number of people have also described the kidney as a master chemist. It does a whole lot of other functions. It is involved in the homeostatic balance of water and acid base in the body. It does hormonal functions. Some hormones, like erythropoietin, that takes part in the production of red blood cells, are synthesized in the kidney. When the kidney functions begin to get deranged, some of these functions that it carry out will begin to have some issues, and of course you'll start having manifestations of symptoms. For instance, if erythropoietin is no longer produced in the body in the usual quantity, the body system will start having challenges with low production of red blood cells, which invariably will lead to anemia. If the waste and toxins that you usually remove begins to accumulate in the body to a dangerously high levels, it can present in form of swollen feet, swollen face, and a whole lot of other manifestations that usually come with it. But with me in the studio this morning is a consultant nephrologist who will be doing justice to this topic. Her name is Dr. Stella Chinyelu Alagbe. She is the HOD, Nephrology Unit at General Hospital, Marina, here in Lagos. The theme of this year's World Kidney Day is Bridge the Knowledge Gap to Better Kidney Care. Doctor, I'd like to welcome you.
Thank you once again.
Once again to you.
Yeah.
So, what do we need to know about chronic kidney disease? Thank you very much.
Yeah, thank you so much, Dr. Barth, and thank you very much for that excellent overview. You actually have done most of the work, and I think there's very little or nothing more for me to add. However, I will still say one or two things.
Yes.
Yeah, so I'm quite grateful and thankful to you for giving us the opportunity to say a few things in commemoration of the World Kidney Day, which we celebrated on Thursday. All over the world, physicians, nurses, technicians, all those involved in the care of kidney patients come together to celebrate this day, to remember this day, because if you work with kidney patients, you, one way or the other, you become involved in their lives and you know the pain, and the challenges that kidney patients face. So invariably, you are passionate about letting people know about this deadly disease so they can do something to prevent it, or at least those who already have some level of it to delay its progression to end stage. So that's why we are here, and that's why the theme of this year's World Kidney Day is bridging the knowledge gap. So what is chronic kidney disease? Dr. Barth has already said that anything that could lead to progressive damage of the kidney, leading to impaired kidney function or reduction in the function of the kidney. And usually we say a kidney disease is chronic when there's evidence that it's been ongoing for at least 3 months. And by that very definition, it actually implies that whoever we are trying to assess must be regular with checkups. So if you've never assessed your health or assessed your kidney function in the past 1 year, and you come to the clinic and we check you and find that there's something going on with your kidneys, we might not know for how long that has been there. We can only guess, based on other parameters. So let me just chip this in. One of the key features, educational points we want to make at this time is regular health checks. And the reason for this, the topic for today is chronic kidney disease, a silent epidemic. Why is it a silent epidemic? Because most of the people that have it, especially in the early stages, don't show any symptoms. You feel well, you feel normal. Globally, the prevalence or the overall rate of kidney disease is put at 10%. So in the Nigerian population, for instance, that means an estimated 20 million people have one level of chronic kidney disease or the other. But more than half of these people are completely asymptomatic. They have no idea that they have kidney disease or any illness whatsoever. So the most important thing about chronic kidney disease is that you must do regular checks to pick it up. Now, having said that, there are multiple things that cause chronic kidney disease. I want to look at it from the point of view of predisposing factors, initiation factors, and progression factors. There are things that predispose you to chronic kidney disease, some of which include one. You may be surprised, the fact that you are black. The black race is known to have a higher prevalence of chronic kidney disease due to some genetic issues that are passed on. 2, if you have some chronic diseases like hypertension, diabetes, just having those diseases alone is a predisposing factor. It doesn't mean that everybody that has hypertension or diabetes will come down with kidney disease, but such people are at more risk. Then, what are the other predisposing factors? Include obesity, that's overweight, and all that. And then, of course, the older you are, the higher the prevalence. So older people, the older you get, please keep an eye on your kidney function. Then what are some of the initiation factors? I mentioned before that hypertension and diabetes are predisposing factors. So if hypertension and diabetes are well controlled, they remain as that, predisposing factors. So they just predispose you, but you don't actually have the disease. But when you have blood pressure and you don't pay attention to it, and it becomes sustained, uncontrolled hypertension, or you have diabetes and you don't pay attention to controlling it well, the end result is that it will initiate changes in your kidney that, if allowed to go on for long, can become irreversible. So sustained, uncontrolled hypertension, uncontrolled diabetes, such things are initiation factors. They can actually cause your kidneys to deteriorate.
If I may come in here, and sadly, these 3 medical conditions you mentioned actually can occur, or someone can have it for a number of years, a number of months without knowing it. Ditto for hypertension, we refer to it as a silent killer. Diabetes as well, okay? Some types of diabetes an individual may have, and over a period of months to years, you may not even have an idea that you have. So how do we go about getting to know some of these things? Of course, you've mentioned one of them, the regular checks that we need to do. What are these regular checks? Is it just measuring our BP? Are there some other things we need to do? Thank you very much, Ma.
Thank you, Dr. Barth. Of course, health check, and health check, basic. And interestingly, or thankfully, the tests that we need to do to diagnose kidney disease are very simple and cheap. One of the simplest tests is a urine test. Very simple, very cheap. You can even do that in the chemist. It can pick up simple things like what we call proteinuria. That is protein in your urine. The urine, the blood is supposed to be filtered through the kidneys, and so the kidney actually acts as a sieve. And that sieve is supposed to retain proteins and nutrients and important antibodies and stuff within your blood while allowing waste products and excess water to go out. But when there's a damage, early damage to the kidney, your kidneys can begin to leak protein more than it should. And when that happens, it can easily be picked up by a simple urine test. So that is one. The other basic test that we do is a blood test called your serum creatinine. You can also check the electrolytes and the urea, but even if it's only the serum creatinine that you can check, that can give you an indication of the state of your kidney, and they are very cheap. It cannot be more than 1,000, 2,000 to do that, simple test. The other test that can be done, of course, is an ultrasound. But a simple urine test and a creatinine test will, go a long way to give you a picture of your kidney.
You mentioned finding protein in the urine, proteinuria. Sometimes we have situations where pregnant women end up having swollen legs associated with protein in their urine. Can that predispose such pregnant women to chronic kidney disease?
Well, okay.
In situations where they have pregnancy-induced hypertension or preeclampsia.
Okay. Well, preeclampsia or pregnancy-induced hypertension is a disease of its own. And it happens because of the presence of the placenta, because of the baby that is there. And usually in most cases, once the baby is delivered, it resolves.
I also like to open the phone lines so that viewers at home can phone in and make their contributions, ask questions, should there be any. Okay, I will take the first lead. Now, talking about having CKD being irreversible, can it be caught early enough? Early detection, can it change the picture here? Thank you very much.
Yeah, thank you, Dr. Barth. Although chronic kidney disease is a progressive damage to the kidney, if it is picked up in the very early stages, like stage 1 or stage 2 kidney disease, it can still be reversible if you institute measures to, stop or to halt the initiating factor, as I mentioned, before. Except, of course, if the cause is non-modifiable, as we say. For example, if the underlying cause of the kidney disease is a genetic condition, for instance, like polycystic kidneys,
it has to do with race. If one is a black.
Exactly. Well, yeah.
And our age too. We can't modify that.
Exactly. So if those issues are at stake here, then it might not be readily reversible. But if your chronic kidney disease is due to, for instance, hypertension and diabetes, and you pick it up, or even obesity, and you pick it up in the early stages, stage 1 or 2, and you ensure strict control of your blood pressure and diabetes, there is a good chance of still reversing your kidney function.
Thank you very much. Now,
earlier
another
stage.
question I have here that usually agitates my mind. Why is it that CKD is on the increase? A whole lot of people appear to be having CKD at the moment. A whole lot of people across the globe, not just here in Nigeria. You see people talking about having this or that, oftentimes ending up with end-stage renal disease, in which case they will need to start going for dialysis and even kidney transplantation. Why do we have an increase? What has changed over the years?
Well, I think overall, well, it's a lot of things come into play here, but what stands out is the changing lifestyle of our populations.
Okay.
Our lifestyles have generally changed from an active lifestyle to a sedentary lifestyle. You know, most people, everything is automated, so you don't really need to do much physical exercise or exertion, unlike several years ago when our ancestors were mostly farmers or hunters, and their occupation is active. So they don't even, exactly. So you don't need to create extra time for exercise. Your job is enough exercise. But these days, you know, things are different. So you also find a rising incidence and prevalence of things like diabetes. In fact, diabetes is exploding, you know. So if the incidence of the risk factors...
Let's take this call. Mr. Lawal, good morning, sir.
Yes.
How is KB State this morning?
Fine.
Okay. Please make your contribution, sir.
I want to... good morning.
Yeah, good morning, sir. Please go ahead.
Fine, sir.
Yeah. We can hear you. You have the floor.
My contribution is about daily exercise.
Okay.
For a kidney patient, it's good to always exercise.
Okay.
Are you done? Okay, thank you very much, ma. He was talking about exercise. How important is exercise? And of course, how long should we exercise?
Well, okay. Generally, exercise is a healthy life habit for everyone, irrespective of your size. You know, some people assume that it's only obese people that need to exercise to lose weight. No, exercise is for everyone and is to keep healthy, not just to lose weight. Ideally, you should exercise for at least 30 minutes, have effective exercise for at least 30 minutes, or at least, you know, 3 to 5 days in a week at the very least, you know, and that's for healthy people. Having said that, I think I caught part of the question, can kidney patients exercise? I think that's what he wanted to say. Kidney patient, everybody can actually exercise, but you don't expect everybody to exercise at the same rate. Because I'm sure you heard from Dr. Barth's overview, one of the symptoms of chronic kidney disease is that they will feel easily tired. They are short of blood. So a kidney patient may not necessarily be able to do, you know, the same exercise that a healthy person will do. So if you have a kidney patient that is sick, definitely that's not the time to engage in active exercise. It's a time to seek help and optimize his care. He needs to, you know, the blood level needs to be optimized. You know, everything needs to optimize. And when he's stable, when he's well, then he can engage in some form of exercise that is suitable for his level of fitness. The same thing with cardiac patients. You exercise according to the level of your overall fitness.
Yeah, thank you very much. Joseph from Edo. Joseph, good morning.
Yeah, good morning.
Yeah, how are you today?
I'm fine. How are you too?
We're good.
God bless you for the program.
You too. Thank you very much.
Okay, somebody that is on a catheter, how often should that person now, maybe, what is the, I think there is much risk in having that kidney problem. So please, I need your advice.
What's the
Can you hear
question?
me?
Somebody that is on catheter, how long should the
On
person carry it?
catheter, somebody that has paralysis from a spinal cord injury and he has been on catheter for a long time.
Urinary catheter?
Catheter, that is for the urine now. How to
Yes,
pass
thank
out
you very
urine
much.
using catheter.
Okay. We need to be
Using
sure.
catheter on his bladder.
Okay, thank you very much. Over to you, my chief.
Yeah, okay, well, for neurogenic bladder, neurologic injuries that makes you unable to urinate or control your urine by yourself, definitely such people will need to be on permanent catheter. There are many reasons, for using a permanent catheter, and if it's indicated, you have to be on it. And there are also different types of urinary catheters. There are some that you can leave for so long, and there are others that you need to change more frequently. And generally, depending on what type you use, your doctor will advise you. But from time to time, the catheters should be changed, and also it should be cared for properly.
The normal catheter, how long should it be changed?
Well, the normal,
silicone catheter, how long should it be changed?
Some can be changed, it can last for up to a month, the silicone catheters, but the regular ones, 1 or 2 weeks.
Okay. Thank you very much, ma. Now, you talked about, okay, let's take Isaac from Abuja. Good morning, sir.
Yes, good morning. Good morning. Yes, I want to commend your effort very much, especially in this awareness. But there's something I'm bothered about. I don't know how much of this program has gone, especially maybe to the villages. For instance, this is one of the medium television. But if you look around, a lot of us, in fact, a lot of Nigerians don't really have access to this television. So if I may ask, are there any other programs like maybe physical awareness where maybe women, ordinary man on the street, or maybe villages, maybe brought this program? Because I feel this is in fact, it's an epidemic truly. So what has been done so far for larger coverage? Because some of us are even interested in, I don't know, maybe is there a foundation or is there something, just something we can even contribute so that maybe this program can reach down to people that it's intended for. So is there anything apart from this television program, any awareness medium? That's what I want to know.
Thank you very much. Thank you very much for that very key contribution that you have just made now. I appreciate that. Now, that said, this program is oftentimes repeated. Like what we are doing now will be repeated on Monday evening by 5 p.m. if I'm not mistaken. Okay, that's number one. Number two is that viewers who may not be chanced, oftentimes I hear that people who wanted to watch the program ended up not watching because NEPA took light. Please pardon me for using that word. So if that happens or becomes a situation around you, you still have an opportunity. You can go to our YouTube channel, wapTV YouTube channel. You can go there, you can get it. Now, if you also want to take it to people who may not have been opportuned to see the program real time, you can actually send it to them, share it in your group through WhatsApp messages and beyond. Because, of course, it has to do with visuals. Otherwise, I will say text message. But I've seen a lot of people share some of our presentations in a group that I belong in. I think these are some of the other ways that I can reach wider audience. Okay, so the wapTV YouTube channel will be displayed so that you can, not just today's presentation, all the ones we have been doing in the last couple of years, 4 to 5 years now. Thank you very much for that.
And
now,
just to quickly add to that, is asking about physical presence in the villages. Yes, at times like this, especially during World Kidney Day, our members of the Nephrology Association in Nigeria actually go to different communities to organize free health check and screening. And in Lagos State, here, different groups had programs in different places, different markets and areas. So, yes, we do something from time to time, but of course, it's still not enough. We still need to reach out more. Thank you for that.
Thank you very much. Now, talking about changing lifestyles. Now, one of the things that I think may have played a role is diet. But my question on diet is this. We seem to focus more attention on Western diet. But I've read one or two literature that even said that some of the diets we consume here in Nigeria are also implicated maybe as a risk factor for CKD, chronic kidney disease. Now, my question is, a few years ago, I happened to travel to India to do a program in one hospital. I was alarmed at the number of Nigerians that I found there that were having one form of chronic kidney disease or the other. A good number of them actually came for transplant. What could be the reason? Does it have anything to do with the diets on certain tribes consume in this part of the world? Or is it just the Western diet that we have adopted over the years? What could be responsible, ma?
Okay, thank you very much. There are several things in our own environment too, that could predispose people to chronic kidney disease. One of it relating to diet is salt. The amount of salt in your diet. When you take too much salt, it also translates, to hypertension and all that. And generally, blacks are known to have what we call the salt-sensitive hypertension. So our type of hypertension is actually driven largely by salt. So if our diet is high in salt, then it is it adds to the predisposition for that. The other thing in our environment that I would say does contribute is widespread use of certain herbal medications. I know that these days there has been a lot of standardization and quantification of them, but you will still see, people hawking herbal medications around the place, and people just plucking leaves and giving their children herbs to drink, and all that. And I have had experience of people coming down with kidney injury as a direct result of certain herbal consumption. I know that there are some that are helpful, but the problem with herbs is that many of them are not quantified, they are not tested, they're not standardized, you don't know their side effects and all that. So you need to be wary about some of the herbs you take.
Thank you very much. Talking about ingestion of herbal concoctions now, this brings us to drugs. A whole lot of drugs, OTC, over-the-counter drugs, that I've seen some of my patients saying that usually for me, if I take 2 tablets of paracetamol, it doesn't stop my headache. I'll have to swallow 6 pills. But it's real. What do you have to say to such people? Because we do know that these are some of the things that can predispose one to having CKD few years down the line. People that abuse drugs take beyond what a doctor has prescribed. I'm talking about prescription, non-prescription drugs now. Even for prescription drugs, oftentimes when we place our patients on some drugs, they continue to take those drugs for much longer than the doctor has asked them to do. Okay, and what are these set of drugs that we need to look out for? Thank you very much, ma'am.
Yeah, so very important issue, especially here, that drugs are not really controlled. Of course, there are OTC, over-the-counter drugs, but even the non-over-the-counter drugs, people in Nigeria can usually get it without, much effort. But it's up to us to be wary and to be careful of what you put inside your body, okay? Take medications that have been prescribed and take medications as they are prescribed, as they are meant to be used. Every medication has side effects, but there are some that if you take them excessively, they can actually directly damage your kidney. One of the common ones is what we call NSAIDs. NSAIDs stands for non-steroidal anti-inflammatory drugs. That's a category of drugs that include things like ibuprofen, diclofenac, Voltaren, drugs in that class. There are drugs that you easily buy.
Also some proton pump inhibitors.
Yes, there are drugs you can
drugs
easily.
For ulcer.
Yeah, you can easily buy them from the pharmacy without any question, but you don't have to keep using them excessively because they can, at the end of the day, affect your kidney. Even regular drugs that you use, if you use them beyond the recommended dose, like the example that Dr. Barth mentioned, it can actually affect your kidney. Remember that the kidney is the organ that clears most waste products, most drugs that you take pass through the kidney to be eliminated. The drugs are not supposed to stay in your system forever, indefinitely. So when they have done their job, they are cleared by the kidney. Assuming that you are in the early stage of CKD, for instance, remember your kidney function is already reduced. Now, if you take excessive amounts of those drugs, even though they are regular drugs, they are normal drugs, they are good, but if you take excessive doses, you might end up building up what we call toxic levels. That means the drugs will not be cleared from your system fast enough, and it accumulates in your body, reaching levels that will cause side effects. So that is why you must be careful with drugs. Drugs are good if used for the reason for which they are prescribed. Use them appropriately. And of course, there are other, the drugs of abuse too, substance abuse. You should be wary of those as well. They can impact your kidney. That
one is a no-no.
Cigarette smoking is a no-no. It's not, I don't even say smoke in moderation. There's no moderate smoking. It's a no-no if you want healthy kidneys, healthy heart, healthy life. Alcohol in moderation, but smoking, a no-no.
Thank you very much. We do know that early stage CKD may not present with any symptoms. But in advanced stage, what are some of the symptoms we'll look out for? What should we look out for, at least in our own environment? What are the signs and symptoms that when we see, we should be warned? Those warning signs that should make us to seek medical help.
Okay. The symptoms of chronic kidney disease are actually many because it's something that can affect practically every part of the body. So, but one of the earliest signs you might notice is that you wake up more frequently to pee at night, especially at night, maybe more than 3 times to pee at night. You might notice that your urine foams a lot. You might notice swelling around your eyelids, especially when you wake up in the morning. And if you are observant, you might notice that the total volume of urine you make in a day is reduced, okay? And that's when your eyes start to swell up, your feet may start to swell up, and then over time, you become progressively weaker. Remember, one of the important functions of the kidney is that it produces an important hormone necessary for blood production called erythropoietin. Without that erythropoietin, your bone marrows will not, be stimulated to produce blood. And remember that your blood is more or less replenished every 3 months. So if you are not making erythropoietin to ask your bone marrow to make blood, then over time that person's blood level begin to drop, and the person will get progressively weak. You might have poor appetite, not wanting to eat, or feel nauseous at the thought or sight of food. And you may actually have recurrent, persistent vomiting for no cause. And at this stage, some people will actually self-diagnose themselves as, oh, I have malaria, because those are some of the symptoms you also have with malaria. You feel weak and tired, you are maybe vomiting, your appetite is not good. But it may not just be malaria. It's a time, it's the right time to check your kidney function. So from vomiting, you may have persistent hiccups. People have hiccups once in a while, but when it becomes persistent, it could be a sign of, kidney damage or chronic kidney disease. And
in children, what I know they may not have. It's not common in children, though. Not that they may not have. What signs and symptoms can we find in children?
Oh, similar symptoms, very similar symptoms. Children do have chronic kidney disease, and they present with similar symptoms. Some facial swelling or puffiness, leg swelling, poor appetite, vomiting. Exactly. Okay, fluffy hair, especially if their kidney disease is due to, nephrotic syndrome, where they lose a lot of protein. Yeah, they will have fluffy hair and all that. So, those are the common symptoms. As it progresses, yeah, like I said, it can affect every part of the body. If it affects the brain, the person can actually have altered consciousness, which can progress to seizures or convulsions or
Just a
complete
minute.
coma.
We have Uloma again from River State. Good morning.
Good morning, doctor.
Yeah. How are you today?
I'm fine too, and you?
Yeah, thank you very much. Please go ahead.
I appreciate your program,
Thank you, sir.
and I love it. God bless you.
God bless you too.
I want to ask a question different from what you have today.
Okay.
And I've been waiting for this topic, but I couldn't get it.
Okay.
Sorry. Can I go on and
Yes,
ask the question?
go ahead. Go ahead.
Okay. This is 1 year. For the past 1 year now, I have a son of 20 years. And he started March last year complaining of neck pain. He couldn't turn his neck left or right. At the initial time, I thought it was how he slept. When I placed him on drugs, he couldn't walk, and I took him to hospital. And after all the tests, doctor said it was muscle. And he was placed on drugs and neck collar. After using the neck collar for some weeks, there is no result. I decided to drop the neck collar. I went to another hospital. They gave him drugs. The doctor complained maybe the posture, how you used to stay, or this or that. All to none avail. But this is 1 year now. He can now turn his neck left or right. But the center of the neck, he couldn't feel free. It's paining him inside. When you press it, it will not pain him, but he couldn't bend his neck down. So I want to ask, what could be the cause and what can we do?
Okay. Thank you very much. A number of medical conditions can actually give rise to the picture you painted. Okay. Some of them may be related to trauma. But in this case, you said there was no history of trauma. That's injury to the neck. Okay. It could also be, it may also have to do with congenital problem that the child may have had before probably he got to that age. But my advice will be this, okay? He needs to see an orthopedic surgeon. It's going to be a multidisciplinary approach to his treatment. So I will advise you take him to a teaching hospital where you have a handful number of doctors that will come around and then do the necessary evaluation that is required and be able to pick out the diagnosis. It's difficult for anybody to speculate that it could be this, it could be that. Okay, but for something that has lasted for this length of time, a period of 1 year, needs to be properly evaluated. So I will advise that you take him to a teaching hospital where I'm sure you will have a number of consultants in all the relevant fields that will be able to attend to him. Do you have anything to add, Ma?
I totally agree with you, Dr. Barry. It needs to be properly evaluated,
Yes,
investigations done. And
it's key. The diagnosis has not been gotten from what you have painted, from the picture you have painted. Now, CKD and COVID-19. What can you say with respect to COVID-19 and chronic kidney disease? It looks like that will be our last question.
Okay.
And additionally, can people who have CKD go for COVID vaccine?
Okay. Yeah. Well, we know even before COVID that viral infections is a well-known cause of chronic kidney disease. Viral infections like hepatitis B, hepatitis C, HIV, they all can cause chronic kidney disease. And when COVID came along, really, we have seen many cases of COVID-associated kidney disease. Some of them are acute, but from initial studies that are being done, it is very, very possible that COVID also causes something similar to what HIV does.
Thank you very much. It's on that note that we want to thank you so much for coming. We appreciate you. Of course, this is your second time. Hopefully, we'll be able to bring you some other time. Bye-bye.